Lastly, I just want few minutes, I promise, to talk about dermatomes. And dermatomes is a segment of the skin, and that a single dermatome is an area of the skin that is innervated by the cutaneous branch of the spinal nerve. For example, in here I can see C3, this dermatome, which means segment, uh, this piece of skin, I'm just talking about skin, no muscles, nothing, just skin, is monitor, the sensations are innervated by the cutaneous branch of C3, 1, 2, 3 of this segment, okay? So what is this used for? For example, if I tell you in class discussion, I tell you, well, I had a individual I was testing for uh, um, general senses, for the general sensations. So I was using a cotton ball to test for light touch, maybe a needle for pain, something cold for temperature, um, and so forth. Okay, you can test also vibration and pressure. Uh, so I was testing, and when I was going here, C3, I placed my cotton ball in these areas. Everything was fine, was fine. In here was fine, in here was fine. Actually, in here at the level of the nipples, this is T4. This is a very common used point of reference. So at this level, he or she felt everything. But when I tested for C5, it did not, she or he did not feel anything. If the sensation is if the sensation is numbness, you call that paresthesia, and if the person doesn't feel anything, you call that anesthesia. Okay, so I can tell you, well, he has anesthesia from T5 and below. What do you think is going on? Well, now you can suspect that that individual has a spinal cord injury at the level of, what did I say, T4 and T5? At this level, T4 and T5. So let's look maybe for an herniated disc, or, well, we're gonna start studying for a lot of causes that can produce that in here, maybe spinal cord section or car accident, blah, blah, blah. What other use this map has, or these dermatomes have? When we are going to administer epidural anesthesia, you need to choose, well, the surgeon is going to tell you, I'm going to perform a surgery on maybe in the thigh or in the lower abdomen, so he can provide anesthesia, right? Usually is in here, L2, L1. He go to the epidural space, or usually a little bit higher to make sure, but usually it's at L1 to 12. They administer the anesthesia and they block all the skin sensations, all the somatic fibers in from this segment down. If the surgery is going to be performed maybe in the thoracic area, they can administer the anesthesia on a higher level, and then they will numb or produce anesthesia in the lower segments. Okay, so this is how we apply all of this knowledge that we have now, that you have now, about the peripheral nervous system. So see you in the last part of this, what is this? Nervous system. And we're going to discuss in the next chapter autonomic nervous system. This is all the somatic division of the nervous system. Let's discuss now the visceral division. And then we're done, dude, with this chapter and this module. See you later, alligators!